You know how a great chef perfects a recipe? They don't just wing it, right? They measure, they taste, they get feedback, and they keep tweaking it until it's just right. Well, what if we applied that same kind of precision to healthcare, where the goal isn't a perfect dish, but a healthier life? That's exactly what we're diving into today, the science of evaluating patient outcomes. It's all about how we refine the recipe for better health. So here's the big question. How do we really know if a healthcare treatment is working? I mean, it sounds like a simple enough question, but the answer, well, it's way more complex than you might think. It goes so much deeper than just asking, hey, do you feel better? You need hard data, you need different perspectives, and you need a really structured way of knowing if a treatment is truly making a difference. This one question is right at the heart of modern medicine, and we're about to break down how we find the answer. All right, here's our game plan. We'll kick things off with why this stuff is so important in the first place. Then we'll define what the process actually is. From there, we'll check out the toolkit that healthcare pros use, talk about the real-world challenges they run into, and the strategies they use to get past them. And it all leads up to the ultimate goal. So, let's start with that big why. First up, why does this matter so much? Look, this isn't about paperwork or just ticking boxes. Think of evaluating outcomes as the compass that guides every single clinical decision. It makes sure that a patient's care is always heading in the right direction. Honestly, it's the very foundation of effective, evidence-based healthcare. It's absolutely fundamental. Without it, doctors and nurses would pretty much be flying blind, just relying on hunches instead of solid proof. When you get right down to it, this whole process serves a bunch of connected functions. It gives us the hard data to see if a treatment is actually working. That data then directly guides clinical decisions, like whether to adjust a medication. All of this, of course, raises the overall quality of care and pushes for practices based on real evidence. But here's the really crucial part. It puts the patient at the center of everything, making sure their own experience is a key part of the data. So, what does this process actually look like in practice? Well, it's not just a one-and-done thing. It's a continuous, methodical way of understanding a patient's entire health journey. Okay, here's the official definition. Let's pull it apart. Systematic assessment just means it's organized, not random. Effects of clinical interventions means we're measuring the impact of what we do. And it's looking at three huge things: a patient's physical health, their ability to function in their day-to-day life, and of course, their overall quality of life. Let's make this super concrete. Imagine a patient with high blood pressure. For them, evaluating outcomes means regularly checking their blood pressure readings, asking if they're sticking to their medication, and seeing if those lifestyle changes are helping. All that info lets a doctor say, okay, the plan is working, or, we need to make an adjustment based on this evidence. It's a living, breathing process. So how do healthcare professionals actually do all this measuring? Well, they've got this really powerful toolkit with all sorts of different instruments designed to capture the complete picture of a person's health. This toolkit basically has two main categories. On one side, you have clinical indicators. This is the objective, hard data, stuff like blood pressure, lab results, x-rays. On the other side, you have patient-reported outcomes, or PROs. This captures the patient's own experience, their pain, their emotional state, how well they can function. I mean, think about it. A treatment might look great on a lab report, but if the patient feels worse, is it really working? That's why you absolutely need both to get the full story. And the toolkit doesn't end there. Professionals also use things like functional assessments to see if a patient can do daily activities. They do comparative analysis to track progress before and after treatment. And they use standardized scales to make sure everyone is measuring things like pain or depression in the exact same way. It's all about consistency. Here's a perfect example of how this all comes together. After a surgery, a doctor will look at the clinical indicator, how the wound is physically healing. But they'll also use a pain scale, that's a patient-reported outcome, to understand what the patient is actually feeling. You combine the two, and suddenly you have a complete 360-degree view of their recovery. Now, in a perfect world, this whole process would be totally seamless. But we all know that hospitals and clinics are incredibly complex and busy places. So what are some of the real-world hurdles that make this so challenging? Yeah, there are a few big ones. First off, we're all different. Our unique bodies mean we can respond completely differently to the exact same treatment. The data itself can be a problem. Maybe it's incomplete or not totally accurate. And while self-reports are vital, they are, by nature, subjective. But maybe the biggest challenge of all is just the lack of resources, time, staff, you name it. This chart really says it all, doesn't it? The amount of time and people you'd ideally need for a really thorough evaluation is often way, way higher than what's actually available in a busy clinic. That gap is a constant challenge that healthcare systems are always trying to figure out.
Okay, so we've laid out the problems, but the story definitely doesn't stop there. Healthcare institutions are working all the time to come up with new strategies to get over these hurdles and make their evaluation processes even better. There's a pretty clear four-step strategy for this. It all starts with standardizing things, creating consistent rules so everyone's on the same page. Once you have that, you can properly train staff to collect and understand the data. That leads to better engagement with patients, which makes the reporting more accurate. And holding it all together? You guessed it, technology. And technology is a total game changer here. Seriously. Things like digital health records and real-time monitoring systems let us track everything from vital signs to patient feedback, continuously and with incredible precision. This is what helps close that resource gap we just saw, making high-quality evaluation more achievable than ever before.
So let's bring this all home. We've talked about the why, the what, the how, and the challenges. So what's the end game? What is the ultimate goal of all this work? I think this quote just nails it. It's the bridge. On one side of that bridge, you have the hard science, the data, the evidence-based medicine. And on the other side, you have the individual person, the patient, with their own unique needs. Outcome evaluation is what connects those two sides. And when you do that, you create this amazing positive feedback loop. See, better evaluation gives us better data. Better data lets us make better decisions. And better decisions lead to what this is all about, better health for patients. It's a non-stop cycle of improvement. So if there's one thing to take away from all this, it's this. The next time a doctor asks you to rate your pain or describe how you're feeling, just remember what's happening. You're not just answering a question. You're an active participant. Your answer is a crucial piece of data that is directly fueling the science of better care, not just for you, but for everyone.